Hi, today let us learn about combination syndrome. But before coming to combination syndrome, let's understand what is single complete denture. A single complete denture is a complete denture made to fit any one of the two arches opposing either natural teeth or various forms of artificial teeth. Single complete denture is a process which replaces the lost natural teeth and its associated structures functionally and aesthetically as a single unit which opposes all or some of the natural teeth. This is single complete denture by definition. Now, single complete denture can be opposed by natural teeth, removable partial denture, fixed partial denture, tooth supported over denture, implant supported denture. Problems associated with a single complete denture opposing natural teeth are tipped, supra-erupted, malposed natural teeth results in uneven occlusal plane. Unfavorable occlusal forces can destabilize the denture, causing soreness and ultimately ridge resorption. Supra-erupted teeth can reduce the space available for proper teeth arrangement. Factors to be evaluated are preservation of alveolar ridge. Force of jaw closure is greater with the natural teeth than complete denture, which leads to more resorption. Stability of mandibular denture is very difficult due to tongue movements, which will increase pressure on mucosa and bone, again leading to loss of alveolar ridge. Necessity for retaining maxillary teeth. Difficulty in retaining maxillary dentition is associated with congenital cleft or artificial or accidental or surgical trauma. Mental trauma. Some patients become depressed by removing teeth. Removal of maxillary teeth, even if indicated, has to be carefully analyzed and retained. Coming to disadvantages, extensive morphological changes in denture foundation can be seen in single complete denture situation. As we spoke, as the force from the natural dentition is bit more than the complete denture occlusion. Jaw relationship extremes which make it difficult to arrange artificial teeth for the denture along the line of support. Extensively displaceable denture bearing tissues. Indications: natural teeth sufficient in numbers not to necessitate a fixed or removable partial denture. A partially edentulous arch in which the missing teeth have been or will be replaced by the fixed partial denture. A partially edentulous arch in which the missing teeth have been or will be replaced by a removable partial denture, and existing complete denture. Coming to greater challenges, difficult to stabilize lower denture. Mandible is the mobile member. Proximity of tongue, more resorption than maxilla, limited availability of good quality mucosa. Coming to complications, combination syndrome, wear of natural teeth, and fracture of denture. Coming to combination syndrome. Combination syndrome is coined by Ellsworth Kelly in 1972, but Tillman spoke about in 1961. Tillman spoke about a situation where maxillary arch is having removable partial denture and mandibular arch is edentulous. However, the presented situation is not very common, and in 1972, Ellsworth Kelly introduced the more commonly seen situation of single complete denture as mandibular removable partial denture with natural anterior teeth and maxillary edentulous arch. Coming to prevalence, mandibular canines are the most retained for the longest time, followed by mandibular incisors in the mouth. Maxillary single complete denture opposing lower natural teeth is a more frequent occurrence. Thus, combination syndrome is also called as Kelly syndrome, as it is introduced or coined by Ellsworth Kelly in 1972, and it is also called as anterior hyperfunction syndrome. Coming to definition, the characteristic features that occur when an edentulous maxilla is opposed by natural mandibular anterior teeth, including loss of bone from the anterior portion of maxillary ridge, overgrowth of the tuberosities, papillary hyperplasia of hard palatal mucosa, extrusion of lower anterior teeth, and loss of alveolar bone and ridge height beneath the mandibular removable dental processes. Kelly enumerated 5 cardinal features in combination syndrome, and those clinical features are loss of bone in anterior maxilla with a subsequent replacement by flabby fibrous tissue, supraeruption of lower anterior teeth, bone loss under the lower distal extension removable processes. Maxillary denture will move upward anteriorly and downward posteriorly. Thus, posterior palatal seal area develops a negative pressure, which will lead to downgrowth of tuberosity in reference to hard tissues, and papillary hyperplasia is seen as a soft tissue response to this negative pressure formed in the posterior palatal seal area because of the downward movement of posterior and upward movement of maxillary denture because of the instability in occlusion. Saunders et al. In 1978 contributed with more clinical features in combination syndrome, which are loss of vertical dimension, occlusal plane discrepancy, anterior spatial repositioning of mandible, loss of stability and refabrication of the existing dentures, epilis fissuratum, periodontal problems of the remaining natural teeth. Coming to rationale, prevention of rapid resorption of the bone under the lower removal processes by increasing stability through extension up to tremolar pad. Prevention of excessive load in anterior region by providing a stable occlusal scheme. Posterior occlusion free of interfering contacts during centric as well as eccentric moments. Minimum contact in anterior region even in protrusive movement. Anterior teeth to be used only for phonetics and aesthetics. Prevention and treatment planning. Retaining weaker posterior teeth, fabricating a fixed processes in the lower posterior region using tooth-supported overdenture in mandibular arch. Malpost, tipped, and supraerupted teeth in mandibular anterior makes it difficult to attain balanced occlusion, which can lead to unfavorable occlusal relationship or anterior repositioning of mandibular arch that tend to displace maxillary denture anteriorly, causing soreness, mucosal change, and finally ridge resorption, thus providing stable occlusal platform to control resorption and discomfort to patient is a treatment modality. Type of occlusal scheme must provide a balanced occlusion for the complete denture situation. Complete single complete denture may be opposing a natural dentition, a fixed partial denture, an existing partial denture, and a present complete denture. Obtaining bilateral balanced occlusion, in particular, is very difficult to achieve in a single complete denture opposing natural dentition. In place of conventional polymethyl methacrylate denture-based material, metal denture base is used to rehabilitate completely edentulous maxillary arch, as it helps in preventing resorption of residual ridges and improves fracture resistance, better dimensional stability, more accuracy, less weight, and better retention of the processes. Coming to conclusion, the single complete denture challenges the clinician more than the patient. The difference in biomechanics of the supporting tissues of the opposing arches challenges the clinician as well as the patient. So, understanding and proper evaluation of the existing factors and its impact in denture fabrication is necessary to provide more stable processes. Thank you.